Einstein Healthcare Network is one of Philadelphia's oldest, longest-standing healthcare networks. It comprises 4 hospitals, 3 acute care hospitals, and 1 rehab network, Moss Rehab. Einstein has traditionally served its community, which has evolved over time. More recently, the community surrounding Einstein Medical Center Philadelphia has become more poor and has a larger indigent, underserved population, very large Medicaid and Medicare population. The 340B savings program has been very important to Einstein Medical Center Philadelphia, and there are several very good examples of how our patient population has benefited, we see in treating the hepatitis C patients. 340B savings allow us to put a pharmacist directly in our outpatient practice, and that pharmacist can work directly with patients to get them their hepatitis C treatments more expediently, navigate acquisition of the medication, work with the patient for medication reconciliation to be sure there are no drug interactions, and actually participate in teaching the patient not only about their treatment but also about their disease, the course of treatment, and their recovery. So they become a very important complement to the physicians and the mid-level providers that take care of these hepatitis C patients. And one of the things that we've done specifically because of 340B is to send our outreach personnel into opioid treatment programs and alcohol treatment programs. Unfortunately, hepatitis C is common among patients with a history of alcohol and drug abuse. And so we recruit patients from these clinics for treatment. In doing so, we happened to recruit a young man who was so benefited by his treatment and his interaction with our group, as well as our addictions counselor, also supported by 340B. This fellow actually decided to pursue a career in recovery and therapy, and now is carrying it forward by having now become a licensed provider and sending us many patients who, like him, benefit from our 340B program. If the 340B program were scaled back or eliminated for Einstein, I think that our patient population would suffer significantly. Most of the patients who come to us are not of great means. In fact, 85% of the patient population coming to Einstein is covered by either Medicaid or Medicare, and those really rarely cover the full cost of care. The 340B program allows us to close that gap. And in doing so, we can continue to provide services across the board to all our patients. Scaling back 340B could very well limit our ability to do that.